Hello, welcome to this short video. In this video, I will share with you a very simple and effective mnemonic to do bedside rounding. If you are a medical student, intern, resident, or even a new attending physician, just started your physician job, I am confident that this mnemonic will make your life much easy to do the bedside rounding effectively and efficiently. Hi, my name is Dr. Farzana Haq. I'm an associate professor of medicine currently practicing in the US. So, the mnemonic which I use for efficient and effective bedside round, the mnemonic is ROUND, ROUND. Let's now break it down that which things are stand for this mnemonic round. The first word is R. R for review concerns. Remember, if you are not addressing patient's concern at the morning, at the first step of your encounter with the patients, doesn't matter what important things you are talking to them, nothing will go to their ears, nothing will go to their brain. So always show empathy and ask them about concerns. You can frame it as, okay, how was your night? Did you get sleep? Anything concerning overnight? After the R, which is review concerns, then next is O. O stand for outline the current status. You can ask them how they are doing, the breakfast, is there any pain, or anything very important complaint that may be pertinent with their main reason for admission. For example, if you have a patient which is here for asthma exacerbation, pulmonary embolism, definitely you will ask about shortness of breath, any racing of the heart to those patients. In contrast, if you have a patient got admitted for GI bleeding, you will ask them, okay, was there any blood in the stool? Was there any vomiting, any blood in the vomiters? So the next one is O for outline the current status. Then U stand for updates. What are the updates? Many things. Maybe you are doing any test, update them about it. Maybe you are changing the medication, changing the dose of their home medication. Maybe there is the plan that patient will do any procedure. So update them. Remember, it is always very important to update the patient what you are doing sooner rather than later, because no patients like to be surprised if their medication has been changed or if they are suddenly been scheduled for any test. Then the next letter in the mnemonic is N. N stands for next steps. What is your next step for this patient? It could be patient will have discharge planning later today, or maybe patient will have other team, you will call them. So whatever the next step is for this patient care mentioned, the next step could be you can tell that, okay, you are the intern taking care of this patient, and then maybe later in the day, you will come back to see the patient along with your team, along with your attending physician. So whatever is the next step, make sure you are sharing with the patient briefly. And the last word, the last letter in the mnemonic is D. D is for discharge planning. Remember, the discharge planning is critical component of patient care, because you already know that during the discharge, we are doing transition of care. And research has been shown that during the transition of care, there is a high chance of communication breakdown, medical error. So make sure You are telling about the patients about their discharge plan. It could be later that day, or it could be next day, or what is the tentative plan of that patient discharge. And when you are talking about the discharge, quickly mention them what will be their follow-up. Like definitely they need to follow up with their primary care physician or which other team they need to follow up as outpatient. So this is the mnemonic which I found very useful, and I always teach my mentees, the medical students and residents about this mnemonic, which is ROUND, ROUND, for efficient and effective bedside rounding. I hope you find this mnemonic helpful. If you are using any other mnemonics that is helpful for you to do the bedside rounding, please share this under the comment. Maybe your mnemonic will be helpful for the audience of this channel who are the medical students or trainee in their career journey. Please like this video, subscribe to this channel, because your support, your subscription gives me motivation to make more useful videos for you. I will see you in the next video. Until then, take care.